everybody's attention, please? We're going to call the meeting to order. If everybody could take their seats. And we're going to start the meeting with a ceremonial piece. And so I'm going to move myself over to the podium. Let's try that again. That's better. Good evening, bonsoir, Kwe. Ottawa is located on the unceded territory of the Algonquin Anishinaabe Nation. On behalf of the Board of Health, I would like to honor the lands and the people of the Algonquin Nation whose ancestors have lived on this territory for millennia and whose culture providers, researchers, emergency responders, or others. OPH values its productive working relationships with partners and stakeholders in the fulfillment of its mandate. As I'm sure everyone is aware, partnership has been very important in responding to the opioid crisis that has affected so many communities across Canada. A recent report from the Ontario Drug Policy Research Network shows that Ottawa is a provincial leader in naloxone distribution and training. This is good for our community, and it's one of the many examples where partnerships are so important. It is in that context that today we honor some of Ottawa Public Health's partners in overdose prevention and response. At this time, I would like to invite Mark Barnes to come forward to be recognized for the work he has done in the addiction treatment and overdose response. Mark is the owner of Respect RX Pharmacy, which includes several addictions and complex mental health focused locations across Eastern Ontario. Mark is a very passionate advocate for the respectful approach to addiction treatment. In the early days of the illicit toxic drug supply crisis, he was the first in Ottawa to develop and implement a program of fentanyl patch return to help curb diversion of this deadly drug to the streets, which has received significant local, provincial, and even national attention, and is now Ontario law, as well as being a practice standard for the College of Physicians and Surgeons of Ontario and the Ontario College of Pharmacists. More recently, Mark has played an instrumental role in naloxone training and distribution across Ottawa. Over the last few years, he and his pharmacy staff have trained over 30,000 people on the proper use of naloxone and the signs and symptoms of opioid overdose. Thanks to Mark's pioneering efforts, Ottawa has become a provincial leader in per capita naloxone training and distribution. In addition to this, Mark shares his passion and expertise in addiction at the local, provincial, and federal level. He is a member of the National Advisory Council on Prescription Drug Misuse through the Canadian Centre on Substance Abuse. He works with the Canadian Pharmacists Association on medicinal marijuana and opioid overdose policy development. He is also on Health Canada's Safer Supply Task Force. Since its inception in 2015, he has been a valuable member of and contributor to the Ottawa Overdose Prevention and Response Task Force. Mark, on behalf of the Ottawa Board of Health, I thank you for all your work in making Ottawa a safer and healthier city. Your work truly makes a difference in the lives of Ottawa residents. I would now like to invite Mike Wood, Michael LaBelle, and Peter Gilroy from Ottawa Special Events to come forward to be recognized for their work in bringing together local influencers to amplify Ottawa Public Health's party-safe messaging. Some of you may remember that as part of my June verbal update, I talked about the partnerships between Ottawa Public Health and Ottawa Special Events. Essentially, Ottawa Special Events recognized the important work OPH was doing and took a leadership role in promoting the Party Safe campaign. Through this partnership, a series of videos were produced with Party Safe messaging for social media, leveraging social influencers. These influencers included local professional musician and Ottawa Special Events employee Mike LaBelle, and players from local professional sports teams, the Ottawa Champions, Ottawa Red Blacks, and the Fury FC, who contributed to videos promoting Party Safe messaging. Of note, Michael LaBelle's video included a personal story of losing a friend and band member to an opioid overdose. This storytelling approach provided a relatable connection to the issues. This shared social media communication strategy between OPH and OSE successfully expanded OPH's social media reach, allowing us to reach a broader population across OPH social media channels. We're able to reach over 112,000 people. Expanding on the momentum of the Party Safe videos, Ottawa Special Events spearheaded a grassroots video campaign where passionate local influencers spoke to the key messages in their own words and shared the videos with their own followers in a peer-to-peer model. In addition, Ottawa Special Events organized a series of naloxone trainings for the general public. Following the success of this collaboration between OPH and OSE, I am pleased to present certificates to Mike Wood, Peter Gilroy, and Michael LaBelle, recognizing their partnership and leadership in supporting overdose prevention and safer spaces in Ottawa. And now we have to move on to the meeting. So one thing that I should mention, we actually have all board members in the house tonight, so to speak. And even though we've had several meetings thus far, we have not had a photo of everybody together. So if everybody could stay around for a few minutes after the meeting so we could get an official photo for the website, that would be appreciated. So I'll ask the board secretary to conduct the roll call.
Member Bana? Mom Kuti?
Present.
Member Di Giovanni?
Present.
Chair Eglee?
Present.
Member El Shantari?
Present.
Member Gower?
Present.
Member Cavanaugh?
Present.
Member Lakin?
Present.
Member Menard?
Present.
Member Pinel?
Présent.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. We have obviously no regrets. We have a declaration of pecuniary interest, so I'm going to ask Vice Chair Di Giovanni to read that out, please.
This relates to the motion on Ontario Health Teams applications. I, Tammy Di Giovanni, declare a potential conflict of interest on the above referenced motion as my employer, the Children's Hospital of Eastern Ontario, is the lead on one of the Ontario Health Team applications.
Thank you. Duly noted. Can we have confirm the minutes of the meeting of June 17, 2019? Thank you. Communications, we have 29 communication items have been received. And then response to inquiries, we have the response to, well, an inquiry I made actually, reducing screen time and promoting nature and outdoor play. Can we receive this inquiry? And I just want to thank staff for the good work that they did on this. It's a very comprehensive piece and outlines a lot of the good work that public health has done and will continue to do in this arena. So thank you very much. I'm going to ask Member Gower to move the motion to introduce reports.
Thank you, Mr. Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled New Official Plan High-Level Policy Directions Presentation, Ottawa Public Health Work on Climate Change, Ottawa Public Health's 2019-2020 Influenza Season Updates, Ottawa Public Health Submission to Health Canada on Proposed Vaping Products and Packaging Regulations, Ottawa Public Health submission to the Canadian Food Inspection Agency on proposed food labeling modernization regulatory amendments, 2018 annual report on attestation to the Ministry, 2019 operating budget Q2 Board of Health for the City of Ottawa Health Unit status report, and delegation of authority contracts awarded for the period of January 1 to June 30th, 2019 be received and considered.
Carried. Thank you. I'll now go through the agenda to see what needs to be held and what we can deal with on consent. First is my verbal report, so we'll hold that. Secondly is Dr. Etches's verbal report. Item number 3 is the new official plan, high-level policy directions, and we have a presentation for that. We'll hold that. And let me just say I'm very excited about this because this is, I think, the first time that public health has really been given a seat at the table in the development of the official plan, and I think that's a very significant step. And I want to thank planning staff for thinking it's a good idea and involving us, and I look forward to the presentation. Number 4 is the Ottawa Public Health work on climate change. We have no presentation. I don't believe there are any delegations registered at this point in time. So can we receive this report for information? Okay, thank you. Number 5 is the Ottawa Public Health's 2019-2020 Influenza season update. And we do have a presentation for that, and I think it's timely, so I think that should be held. Number 6, rather, is the Ottawa Public Health submission to Health Canada on proposed vaping products and packaging regulations, rather. We have no presentation, and I don't believe there are any delegations signed up either. So can we receive this? Received, thank you. Number 7 is Ottawa Public Health submission of the Canadian Food Inspection Agency on proposed food labeling modernization regulatory amendments. Again, no presentation and no delegations. Can we receive this? Thank you. Number 8, the 2018 annual report and attestation to the Ministry. No presentation, no delegations. And again, we would be receiving this report for information. Received, thank you. Item number 9 is the 2019 operating budget Q2 Board of Health for the City of Ottawa Health Unit status report. Again, no presentation, no delegations. Can we receive this for information? Thank you. Item number 10, delegation of authority contracts awarded for the period of January 1 to June 30th, 2019. No presentation, no delegations received. Okay, so we will go back to the beginning, which I think is me. To do the, provide my update. So good evening, and thank everyone for being here tonight. I hope everyone had a great summer, though the way today felt and the forecast for the rest of the week, we may have a reprieve from the fall for a week anyways. For my verbal update this evening, I'd like to begin by updating you on the consultations that have been happening at Ottawa Public Health with regards to the Provincial Public Health Modernization and provide a few highlights on some recent events. In mid-August, during the Association of Municipalities Ontario AGM held here in Ottawa, I had the opportunity to meet with provincial leaders along with Dr. Etches and Mayor Watson. We greatly appreciated the ability to highlight the role of public health in facilitating cross-sector work, focusing on maintaining mental wellness and evaluating the voice of clients and community in health system planning. The Minister, Christine Elliot, also met with me, Mayor Watson, Councillor Cavanaugh, Dr. Etches, and Tony Demonte. It was a very brief meeting where we discussed the municipal transition to a 70-30 funding formula and a renewed consultation process that will be led by a yet-to-be-named expert advisor. These consultations are expected to be guided by a discussion paper, which will include proposed regional boundaries. This meeting provided an opportunity to draw attention to the valued working partnership Ottawa Public Health has with the City of Ottawa. Further to the collaboration with many departments such as EPS and police, OPH also benefits financially from a close relationship with the city, with a range of municipal back office services such as facilities and IT support, at no direct cost to our public health budget and through seamless integration of business processes such as human resources, financial services, and competitive procurement support. All of these municipal investments add up to over $8 million of annual in-kind resources for Ottawa Public Health. And at the end of my verbal report, in line with this, I'll be leaving the chair for a moment and asking the vice chair to take over so we can introduce a motion in this regard. For the 17th year in a row, OPH was involved in the Capital Pride Festival from August 19th to the 25th. Celebrating a diversity of two-spirit, lesbian, gay, bisexual, and trans and queers 2SLGBTQ+ community. The week began with the Pride flag raising ceremonies at various municipal buildings across the city. Ottawa Public Health led the ceremony at 100 Consultation, where I, along with Dr. Etches and a representative from Capital Pride, launched the week and raised the rainbow flag. The festival concluded with the Capital Pride Parade on Sunday, August the 25th, where many of us, councillors, Mayor Watson, and OPH staff, with a lot of water guns, were out in all our colors to celebrate the diversity of our employees and the community that we serve. I think it's unofficial, but I think it was the largest Pride Parade in the history of the event. It was quite an exciting day. So I want to thank all who participated and celebrated along with us. On September the 10th, we marked World Suicide Prevention Day. For the second year in a row, the theme of World Suicide Prevention Day was working together to prevent suicide. This theme was chosen because it highlights the most important aspect of effective suicide prevention, which is collaboration. Recognizing this, Ottawa Public Health has been collaborating and leading efforts in Ottawa with partners both internally within the City of Ottawa and externally in the community to prevent suicides, and co-chairs Suicide Prevention Ottawa, a network of over 40 partner organizations working together to prevent suicides through awareness, education, training, research, and post-suicide support. Again this year, OPH co-hosted an event at the Royal Ottawa Mental Health Centre to educate and raise awareness about suicide prevention. The event was attended by clinicians, caregivers, and those with lived experience, helping to end the stigma around and enhancing the conversation about suicide prevention. Ottawa Public Health also hosted an information booth at 100 Constellation to provide staff and residents with information and resources on how everyone can work towards creating a suicide-safer city, including encouraging City of Ottawa employees to register for one of the upcoming Safe Talk suicide prevention trainings. This half-day training offers tools to help staff learn how to prevent suicide and has been an important strategy in Ottawa Public Health's goal to create a suicide-safer community. Finally, Recovery Day Ottawa was an event held on Friday, September the 13th. This day brought together residents of Ottawa to build awareness, challenge stigma, and celebrate the role that recovery plays in improving the lives of individuals, families, and communities across the city. Ottawa Public Health was proud to work alongside many partners and community members to help support this very important day, as addressing stigma and improving mental health and supporting those with substance use disorders continues to be a priority for Ottawa Public Health. This concludes my report. I'm welcome to take any questions, but perhaps what we'll do first is I will leave the chair and turn the meeting over to Vice Chair, and I will ask her to carry on.
Thank you. I'd like to call on Member Eglee to introduce a motion.
Thank you. Whereas the province of Ontario has proposed the reorganization of local public health units into regional public health entities and has announced proposed changes to the provincial funding formula for public health, and whereas the provincial portion for cost-shared programs and services will be 70% for the 2020 budget, and whereas the Ministry of Health will be undertaking consultations on the implementation of these changes, and whereas Ottawa Public Health provides crucial programs and services to the residents of Ottawa, and whereas Sections 12 sub 1 to sub 8 of the City of Ottawa Act establish that the employees for the Board of Health are provided by the City of Ottawa, and given that the City of Ottawa provides over $8 million per year through in-kind support such as rent, information, technology, purchasing, and human resource services and other administrative efficiencies, which would be cost prohibitive to recreate in a different structure. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit recommend the City Council requests that the Mayor ask the Minister of Health to maintain the relationship between the City of Ottawa and Ottawa Public Health. which maximizes the coordination between public health programs and municipal services and benefits from the integration of administration and other efficiencies. And be it further resolved that the Board of Health for the City of Ottawa Health Unit requests that the Chair of the Board of Health, working with the Medical Officer of Health, ensure that in calculating future budget allocations, the Ministry of Health recognize the City of Ottawa's ongoing in-kind contribution, which is currently not accounted in the Ottawa Public Health's annual operating budget. So that's the motion, and again, I'm happy to take any questions about that or the verbal report. And I think I take the chair back now, or not until after the vote? Not until after the vote. So I'm happy to take questions.
Are there any questions for Member Eglee?
Thank you, Madam Vice Chair. So my understanding from that motion is to keep that dialogue open with the ministry. And as we speak now, not just public health, any budget item is up in the air, so to speak, at this point. So what you are hoping to achieve from this motion?
So I think what we're hoping to achieve, and Dr. Etches and I have worked on that together, and we've also had discussions with the Mayor's office, is to make it very clear that while we are prepared to work with the province, and we have been working with the province for the last number of months, that we believe, and not just this board, but hopefully council will support this as well, that we have a very well-run functioning unit now, and to remove the Board of Health or the health unit from the city writ large actually doesn't create a savings as we see it, but potentially creates an increase in funding, or alternatively, we have to find that $8 million somewhere else, and the somewhere else would be to take away from programs, which is something we don't want to do. So it's not to say we don't want to work with the province. We absolutely do want to work with the province, but what it's to say is we think we have a really good model here, and to split us off, if you will, or change that configuration, what we're saying will come with risk, and we're trying to avoid that risk and keep being able to provide the services that we do provide in a seamless fashion to the residents of Ottawa.
Is there a plan to work with other colleagues in the public health? Because we're not the only one who are going to be affected by the changes or by the budget or the upcoming budget. And we saw at the conference in Kingston, we're not the only one vulnerable at this time, or at least to deal with the unknown. Is there a contact on a regular basis with other colleagues from across the province on an action plan how to deal with this?
Well, I can say that, well, maybe I won't say it. I'll let Dr. Etch say it. But she's been part of a regular working group. Maybe you can tell us a little bit more about that.
Thank you. The motion is meant to be open in terms of different ways this could work out. So the language around maintaining a relationship with the City of Ottawa, that could be achieved in many different ways. So whether there was an independent region, and as it is now, the City of Ottawa Act establishes the Board of Health and says that the Board of Health shall provide, or the City of Ottawa shall provide the employees to the Board of Health. So there are different mechanisms to have less disruption, even if the overall configuration of a regional Board of Health is set up and changes. So it was meant to be open. When it comes to ongoing dialogue formally from the public health sector, that is channeled through the Association of Local Public Health Agencies. And I understand that the executive of the board continues to meet with the Chief Medical Officer of Health. From my perspective as a medical officer of health, there is the Council of Medical Officers of Health that is continuing to have modernization on their agenda. We have a next conversation is the coming week. So this is something that continues to be considered by the field as a whole.
Okay, thank you very much. I mean, this is not the only item we're going to see in the upcoming budget, so I think we need to work together, not just on a public health issue, but I mean, another budget item, which is we fear is going to be cut. But if every cut the province does and the city try to plug that hole, so we're going to make the provincial government look good and our taxpayers suffer because we're going to take that money somewhere else. So I think not just our board here, but as a city as a whole, we need to be able to work together with the mayor and other level of government, making sure those cuts and the impact of those cuts to be identified. Like we can't just say, oh, we're going to put $1 million just because we believe in that service, and we do believe in some of the service. But I mean, if we keep plugging away and helping, I mean, we're the one going, our taxpayers going to suffer, and the profit's going to look good because they managed to download again on us. So I support the motion. I am with you on this, but I want to make sure we have a plan moving forward because we still don't know what the budget is going to look like and what's hidden for us.
Agreed, and as Dr. Escher said, she's working through the organization. The ministry, the Ontario government has said that there will be more information coming, there will be consultations coming with the individual health units. We don't have the dates on that yet, but that is our understanding going forward. So this is more to make everybody understand we have a well-oiled machine here and it's efficient. It does a lot of the things that they're looking for the new system to do. It takes advantage of existing resources in a very positive way, and we want them to be aware of that, and we want them to know that the city as a whole is behind that.
Member Cloutier.
Merci, Madame la Vice-Présidente, and I thank you, Member Eglee, Member Eli El-Shantiri, for your comments. I think it's important, and this motion does it, to formalize the actual numbers and the value that the City of Ottawa provides to the Board of Health, and that is at risk in the reorganization that has been proposed by the province, and how that does not fulfill any of their objectives, as stated by the provincial government. And I think this motion and the value that is provided by the current relationship between the Board of Health, as it's currently constituted, and using some what's called back office and resources of the city, I think it's important to formalize that so that in the ongoing discussions that the chair you've had, I'm sure, with the ministers in the provincial government, and of course our medical officer of health, that provides some support, some substantive support from the board in the discussions going forward. And so that's how I'm seeing this motion, and I'm absolutely in support of it.
Thank you. Member Cavanaugh.
Thank you very much. No, I really appreciate that we're taking this action. One of the concerns I have is just the depth and understanding that the provincial government has on what we do and how integrated it is. It's really like just taking apart something that was already seamless, and I think it's really important to drive that point home. Also, just in the fact that they have to really get that we're more than vaccinations, which are very important, and other things that are more obvious, and the importance of things like climate change that are coming forward, that are not tangible in terms of something that you can calculate, but we need that effort. And I really appreciate all the staff that are working from public health with our city on things like the official plan, which is something that is absolutely essential for the future, and is very, very hard to demonstrate its value, but it's absolutely important. Thank you.
Thank you. Are there any other comments or questions? With that, we'll call for a vote on the motion.
All right, with that, I'll take back the chair, and I'm going to ask Dr. Etches to deliver her verbal report. Oh, sorry. You need to receive my verbal report first, so received. Thank you.
Okay. Bonsoir, Quay. Good evening, everyone. I would like to also provide some highlights from the last few months and then update you on public health system transformation and public health modernization. L'équipe de santé publique Ottawa était occupée cet été. And over the summer, Ottawa public health employees were busy participating in various community events, including Inuit Wellness Day, Somali Fest, and providing overdose prevention and party smart training, as you heard, to various event organizers and volunteers. Helmet safety, mental health, and vector-borne diseases like West Nile virus and Lyme disease continue to be of most interest to our community. The summer event season came to a close with the week-long Capital Pride Festival, and so I also want to thank the Mayor Watson, Chair Eglee, members of the board, and councillors who participated in the parade on August 25th. Je voudrais aussi dire un gros merci aux employés qui ont participé dans la Semaine de la Fierté. It's important for us to promote our values of diversity and inclusiveness. And events in the community provide a great opportunity for us to work directly with partners, provide tailored messaging to specific populations, and receive feedback on our programming directly from Ottawa residents. So September continues to be a busy season, with Ottawa Public Health participating in back-to-school events, responding to requests from community partners, including supporting the launch of Carlington Bike Park, and working closely with the Community Addictions and Peer Support Association, otherwise known as CAPSA, on Recovery Day Ottawa, and promoting mental health, such as events like the Chair alluded to, World Suicide Prevention Day in partnership with the Royal. I also had the pleasure of attending the launch of the LRT, the new light rail transit system, and that does align well with our public health objective to promote physical activity in the city through active transportation. And again, I want to thank and acknowledge the mental health team's work. It involved training LRT operators on suicide prevention and helping them design the stations so that people can directly access the distress center if needed. Aussi, concernant le sujet de santé mentale, Ottawa Public Health has been working in close partnership with the Royal, with CAPSA, the Canadian Centre on Substance Use and Addiction, to implement an Ottawa Community Action Plan, and that is focused on mental health and substance use, particularly to address opioids. The Community Action Plan was posted on our website last week. We will email you a copy after this meeting. And it's been built from community consultations and outcomes of the summit, which you may have recalled happened earlier this year, where 200 participants with lived and living experience, clinicians, community partners all met to identify ideas for action under 3 main goals. So the goals were prevent stigma and substance use, problematic substance use especially, emerging harm reduction initiatives that could reduce harm for people who are actively using opioids, and collaborating and integrating across the health system and different sectors to increase access and uptake of services that better meet people's needs. So Ottawa Public Health continuing to collaborate with these partners on a community impact project to advance one of those areas, especially focusing on ending stigma and emphasizing the importance of using person-first language. So shifting away from language that labels people as a substance abuser towards a person with a substance use problem. That kind of language change opens up avenues for more access to supports. Improving mental health and reducing harms from substances will take many sectors and organizations, and this community action plan helps us focus on priority actions that we can implement now. So moving on to the topic of provincial health system transformation, members will recall in June that I provided a brief update on Ottawa Public Health's involvement with Ontario Health Teams, or OHTs. Ottawa Public Health did participate as a signing member in 3 OHTs that underwent self-assessment. So they were the Ottawa Health Team, which is led by 6 area community health centers, the To Be Named by Kids Ottawa Health OHT, led by CHIO, and the Ottawa East OHT, led by the Montfort Hospital. En juillet, le ministre a annoncé que toutes les 3 applications étaient approuvées pour les prochaines étapes. So all 3 applicants were invited to submit a full application, which is due October 9th. And Ottawa Public Health employees have been participating on multiple working groups across all these 3 OHTs to provide support to completion of the full application. The Ministry of Health expects to announce this first wave then of OHT candidates in the fall of 2019. We see OHT as an opportunity to drive prevention in the healthcare system, and creation of OHTs is transformational work. Therefore, there is a motion to consider today regarding ongoing support from the Board of Health for this collaboration with health system partners. In respect to public health modernization, Ottawa Public Health continues to follow updates from the province and seek opportunities to strengthen our public health system. We've engaged in a department-wide process to ask employees for their thoughts about addressing challenges and realizing opportunities with public health modernization. I'm really proud of the level of engagement that we received. All teams across Ottawa Public Health participated, and also proud of the quality of the discussions and the ideas generated. It's all levels of the organization have thought about our core work, and they've considered ways we can do our work differently. And this is in the context of electronic public health records, which we are implementing and considering increased digitalization. So the senior leadership team and I have worked hard to ensure that employees are continuously kept informed through weekly emails as well as virtual town halls. So using video and taking questions in. C'est important pour moi de maintenir le dialogue avec l'équipe. So I won't repeat some of the details that Chair Eglee mentioned in his verbal report about what we've heard, but I will add that this past Thursday, we learned that the Ministry of Health has appointed Alison Blair to the roles of Assistant Deputy Minister, Emergency Health Services, and Executive Lead for Public Health Modernization. So Ms. Blair is a former Assistant Deputy Minister to the Direct Services Division of the Ministry of Health, as well as Director for LIN Renewal. So on behalf of my colleagues at Ottawa Public Health, I do congratulate Ms. Blair on her appointment, and I look forward to meeting with her in the future to discuss Ottawa Public Health's contribution to modernization. Now, just a couple other things. As you may have heard in recent media coverage, infectious syphilis incidence has been increasing. So the number of cases reported in the 12-month period of July 2018 to July 2019 was about 25% higher than reported the previous 12 months. And this is on top of a trend of an increase over the last 20 years. Syphilis is a bacterial, sexually transmitted infection that can be easily confirmed with a blood test, and it is treatable with antibiotics. However, commonly, a person with syphilis infection may not notice the symptoms, and it can develop serious health harms if left untreated. Ottawa Public Health, therefore, has adopted a 3-pronged approach to deal with this increase. Firstly, we're increasing access to treatment, both through our own sexual health clinics, through Gay Zone, and through providing free sexually transmitted infection medications, so medications to treat STIs to clinicians across our community. We're creating and distributing resources to increase knowledge about testing and management, both for clinicians and for the public. And we have public health nurses and nurse practitioners who are involved in case management who also provide expertise and consultation support to clinicians. So finalement, members may be aware that the federal cannabis edibles and extracts regulations are expected to come into force by October 17th, 2019. And Ottawa Public Health anticipates that this will result in a limited selection of products gradually appearing in the physical or online stores in Ontario. This could likely be no earlier than mid-December, as the license holders need to provide a 60-day notice to Health Canada of their intent to sell new products. So that concludes my verbal update. J'invite des questions. Merci.
Dr. Etches, you mentioned the mental health training of the LRT operators. Is it, I mean, I don't know if OC Transpo drivers already have this training. Has the naloxone kits or naloxone training ever been something, the administration of naloxone for buses or LRT operators? I mean, if they have statistics at OC Transpo that they don't have any overdoses on their buses, it may be something, but I'm just wondering if it's something that EMS, or would they turn that over to EMS? I'm just wondering about the time frame, if their operators would have that training and carry those kits.
I'm looking to a program lead to provide more details. What I do know is that the Safe Talk suicide prevention training is available to all City of Ottawa employees, which would include OC Transpo operators and drivers. I think the other question about naloxone training is something that has come up. The program has been looking. Anything anyone wants to add? Thank you.
Yep, thanks for the question. So we have trained special constables. So OC Transpo has special constables that are they're actually members of our overdose prevention and response task force. I was actually speaking to one of them today. So they are trained. They're usually the first ones that the drivers of the bus or the light rail would call in the event of an overdose or a suspected overdose. So they're usually first on scene, and they will do an initial assessment. If required, they'll call for paramedic support depending on the complexity of the call. But they do have naloxone with them. They were one of the early adopters in terms of naloxone training.
Wondering about the kits being on the bus, that even if the driver had a discomfort level, if someone else was trained to use them, because we know in the case of those overdoses, especially fentanyl, especially you of all people know, Andrew, we could be talking about seconds.
Yep, that's something that we can consider. I know that in conversation with the special constable today, he mentioned that there was certain policies around drivers not leaving their seats and whatnot. So, but that's something that we can look into in terms of making sure that it's available to other people.
Okay, thank you.
Okay, I'm going to ask Member Gower to introduce a motion on the updates.
Thank you, Mr. Chair. It's a motion on the Ontario Health Teams, and I know you all have it in front of you, and given that it's quite a long preamble, I'll just read the be it resolved. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit authorize Ottawa's Medical Officer of Health to continue to partner in the creation of Ontario Health Teams, including supporting the submission of a full application and any operational requirements related to same. And be it further resolved that the Board of Health for the City of Ottawa Health Unit authorize the Chair of the Board of Health to approve and/or sign off on any Ontario Health Team requirements that go beyond operational requirements, for example, governance. And be it further resolved that the Chair and/or the Medical Officer of Health report back to the Board of Health as appropriate on any significant developments on this matter, either at regular meetings of the Board of Health or at any special meetings that may be called by the Chair as needed.
Thank you, Member Gower. And I'd like to note that the Vice Chair has moved away from the table for the purposes of this motion. Are there any questions or comments on the motion? Oh, Member Banham.
This may be operational, it may be too soon, but I'm wondering if there were to be 2 or 3 of these applications to move forward following the full application process, does public health then decide which one to be a part of? Is that something the chair, given this motion, would be able to decide when we're looking at things like governance? Or would we be getting an update and a decision if it came to a decision of which OHT to be a part of?
Through you, Chair. We have spoken to the Ministry of Health, different folks, about how their vision for Ontario Health Teams is evolving. And we have indicated we're participating in all of the Ontario Health Teams that are forming in our area, and indicated that we're interested in their perspective on how that may work in the future. I think this is an evolving situation. Rather than having to choose one, I expect that it would be more of a question of how do we resource all in a way that makes sense for public health objectives. And there are other agencies that have the same kind of question where they're providing supports or services to a broader population across a region. And potentially they're setting up a way to create access to that expertise across a region when it's a regional organization. So we aren't sure yet, and this will be part of what we evaluate. So after the applications are in on October 9th, we're going to sit back as a team and look at what were the pros and cons of being involved, to what level, what are the opportunities for the population's health to move forward, in what ways. So it's really evolving, but I don't think we'll have to choose. I think we'll have to choose how we're involved in all.
And just in reference to the second, be it further resolved, it states that the chair of the board, whom we trust, could approve or sign off on any of the OHT requirements, including governance. Is that only in the application process, or are we talking if when we're having those further discussions on how we are signing on to all three or one or whatnot, would that be a discussion that would come back to the board, or does this motion approve the chair to sign on to governance structures, et cetera?
So this relates to the application process, the full application process. If there was something later on that needed to be decided, that's the kind of significant update we would bring back to the board. Yeah.
Member Lakin.
Thanks, Mr. Chair. Two questions, if I may. The first has to do with whether, in participating in the discussions with the three identified teams, there would be an expectation that there may be any changes in the nature of services or programs that OPH may need to consider as a partner in a primary health team. And if so, is there a risk analysis or a cost analysis that might go with that? And I'll just ask the second, and then you can respond in whatever order. I'm curious about the decision about the partnership choices. I noticed, for example, there's a willingness to have a conversation with a specialty team, a pediatric team. Was there at any point consideration to participate in any other specialty teams, for example, a mental health, Ontario Health team that is about to be launched locally?
The second question I can answer quickly around, it looks like one of these Ontario Health teams is more specialized with a focus on children and youth, and are we involved in other OHT applications that may be specialized, such as on mental health? We are tonight focusing on the ones that are further along in development because of the need to go the next step in a full application, but we are involved in conversations with others who are starting to create Ontario Health teams in the initial self-assessment phase. For instance, the Queensway Carleton Hospital has been having conversations and thinking about the way forward, and we are in touch with mental health service providers who also are exploring how do they make sure mental health supports are available in an organized way to OHTs or through an OHT process. It's not clear yet exactly the route forward for some of these specialized services, but we are at the table talking about ultimately what we want, which is integrated services for patients and residents where it makes sense. They can access everything they need through one system, and that certainly applies to mental health and substance use. That's part of our goals in the Community Action Plan, and I am pleased to say actually that mental health is a focus of each of the OHTs. So they're being asked to identify an initial area of focus, and they are all choosing mental health as something that they want to address. So probably not clear, but that's because it's evolving. And if that answers your question, Okay, and the other question? So I think your question was along the lines of, are the OHT proposals demanding some sort of change in public health services or programs, and is there a risk or is there a cost analysis that's been done? So right now, our experience, and I invite others, Cameron, others to join in who have been part of this, is that really what we're seeing is a way to highlight existing services and bring them alongside the healthcare system in a stronger way, or even to augment some of our work. So, for example, the Ontario Health Team that's being led by CHEO would like to see us expand our Can Immunize work. And so we're at a table thinking about, with other partners at CHEO, how do we grow that work, which is an advantage to us. The same with some of the supports for mental health. We are able to highlight there are services existing in the community, supports for caregivers, and bring those alongside the plans that are evolving in the healthcare system. So at this point, I don't see a significant risk or cost, and that's part of what we'll evaluate at each stage in terms of what's the best way to support the goal of population health.
Thank you very much for that response. One could argue, and I'm sure you would argue, that public health ought to be part of every Ontario Health Team, that really it represents one end of the healthcare delivery continuum. And so could you just very briefly give a little color to whether this conversation about who OPH may partner with is an evolving process, and how it was that these particular three became our first conversations. So I'm just trying to get some reassurance that it's an evolving partnership conversation, given the importance of public health for every health team.
I'm trying to think back to the very beginning of the conversation, but it would have started with the ministry announcement that they have a plan to create Ontario Health Teams that would be integrated systems where hospitals, primary care, and others, whether it's long-term care or home care or palliative care, come together to break down some of those silos between service providers to meet the needs of patients. And further, the province spoke about them as serving a defined population. So that description was exciting to us in public health. We're interested in improving the population's health, looking at the needs of a whole population, and then figuring out how do we collectively, across organizations, across sectors, support that well-being. And so this Ontario Health Team structure can create that incentive for individual organizations to take the focus off just their work and think about the population, the patients, more broadly. So for us, we do think that public health practitioners have the skills to help the variety of partners think about what are those health needs, what are the priorities, and also help take pressure off the system by making sure we're maximizing the prevention initiatives and keeping people well, and linking to social services, for example, where we know that health is supported by other factors like income and housing. So we see it as an opportunity. That's why we then phoned people up and said, are you thinking about being an Ontario Health Team? We're interested. We think we can help. We reached out, and where we heard there were Ontario Health Teams forming, we reached out. And so it is an evolving process. As I mentioned, we're aware that some others are starting to think of them. We'll be chatting with whoever comes forward. So there's no preferred partner here, or we're not being exclusive. We are looking at everything that comes forward.
Thank you very much. Are there any other questions?
So on the motion, carried. And on the report received? Okay, thank you. Next on the agenda that we held was item number 3, which is the new official plan, high-level policy directions. And we have a presentation which I believe Alain Miguelez is going to lead. Welcome. I don't know if this is your first time at Public Health or not, but thank you for coming. And as I pointed out at the beginning, this is an exciting time for public health to be part of this discussion. The official plan is often about bricks and mortar, and so we're very happy that you've decided to bring this more human element into the discussion. And so we'll turn it over to you, and I'm sure there'll be questions to follow.
Thank you, Mr. Chairman. Merci, Monsieur le Président. Thank you for the opportunity. I am accompanied this evening by Charmaine Forgy, who's the manager of our Business and Technical Support Services, overlooking the public consultation for the official plan, as well as 2 planners from Ottawa Public Health, Birgit Isenhagen and Inga Rosendahl, who are actually embedded in the official plan team on a 50% basis. And on behalf of our General Manager, Steve Willis, we'd like to express our thanks and gratitude again to Dr. Etches for allowing that arrangement. We have a team that comprises the core of the policy planners in my branch, which is about 32 people. But there's altogether about 100 people across the corporation and across departments and service areas involved in the official plan in various capacities, and we're actually quite excited to have the contributions of Inga and Birgit in our efforts. As a matter of fact, it's not an accident that when we issued our first discussion papers back in April, a lot of the topics that we normally cover under, the traditional planner speak of, urban form and, land use and things like that, were actually included in a discussion paper called Public Health and a Healthy City. And we did that on purpose. We did that on purpose because if you go back 150 years, urban planning really came about as a response to public health concerns. In the 19th century city, rapid industrialization, rapid urbanization, and a lot of the conditions that were created by densifying cities were, at the end of the day, public health matters. They had to do with sanitation, they had to do with potable water, they had to do with the appropriateness of housing, they had to do with light and air circulation, and they were responding to the epidemics, the health epidemics of industrial cities of the day. And fast forward to today, Mr. Chairman, I think it's fair to say that we have other public health outcomes of the way we've built the city. And therefore, it's almost coming full circle that as we contemplate an official plan for the 21st century, the way we build the city is very much taking into consideration human health, public health. So the presentation that I have for you has to do with the first stage of official plan preparation, which is the strategic stage. We tabled on August 22nd to a joint committee of planning and agriculture and rural affairs high-level policy directions, which are in draft form, and basically flow from what we call 5 big moves. And those 5 big moves are the 5 major ways in which the new official plan has to differ from the previous official plans in terms of how we plan the city's future. As well, we presented population projections and growth scenarios to 2046. So when we talk about a city, we talk about people. This year was a milestone for Ottawa. We crossed 1 million population in the city of Ottawa. But we've been talking about 1 million for a long time. Actually, the greater National Capital Region metro area crossed 1 million in the mid-90s. We're now at 1.5 million between Ottawa, Gatineau, and the surrounding Ontario and Quebec municipalities. And in the next 25 years, we anticipate that the city itself will be over 1.4 million. The greater Ottawa-Gatineau area will be at 2 million or thereabouts. And so it's entirely foreseeable that between then and the end of the century, we could be looking at a metropolitan area of between 2 to 3 million people. So we have to, as we prepare the official plan, which is for the first 25 years of that time, also start to think about what things we need to put in place for a city and region that will be in the 2 to 3 million population range by the end of the century. One of the things that we've submitted from the inception of this new official plan is that it is a new official plan. It's not a revision of the old official plan. It's a completely new document. And one of the primary goals that we have is to make Ottawa the most livable mid-sized city in North America. So just, again, by context, in the Canadian context, we're a big city. We're one of the 6 million plus metropolitan areas in the country. In the North American context, we're a mid-sized city. There's about 43 other municipalities and regions that are about our size. We are lucky to punch a bit above our weight because we're a G7 capital. We're more visible on a global stage. We are known for our role as the nation's capital. But I think as we take advantage of the critical mass of our population, we're also starting to see how we can leverage that into greater visibility and a greater leadership position for the city in terms of urban planning, among other things. So here are the 5 big moves that we tabled at joint committees in August. These, by the way, went through several different hands, both internal to the city, across the corporation, and across departments. All of SLT was consulted on these, as well as through a variety of external stakeholders across the various industries that usually deal with urban planning, communities that deal with urban planning, but even beyond that, you know, arts and culture. We have an ambassadors group that Charmaine has assembled that looks through the equity and inclusion lens at a variety of underrepresented populations, inviting them to be a part of shaping the city and its big moves. So the first thing that we want an official plan to do is to basically outline how the city's going to grow. So that's growth management. We're anticipating 1.4 million population. Where is that population going to live? Where is it going to work? Where is it going to go to school, to shop, to go to parks, to libraries? So the first big move is basically to continue the momentum that we've been achieving since amalgamation, by which we've been one of the first Ontario municipalities actually to set intensification targets. And I think we're the one that has actually surpassed them, reached and surpassed them. So it used to be in the days of the old region of Ottawa-Carleton that, you know, we will encourage intensification, but most growth will be through suburban expansion. This is the official plan where things flip the other way. Most growth will be through intensification, and a diminishing minority will be through suburban expansion. So that's the first big move. That means that we have to accommodate more of the new population in existing built-up areas, existing neighborhoods, and the areas that we target for intensification, our nodes and corridors, our main streets, and employment hubs. Hand in hand with that is the second one, mobility. In our transportation master plan today, we have a 2031 goal of half of all trips in Ottawa that are targeted to be through active transportation, which is transit, walking, and cycling. So the second big move is that the majority, so over 50%, and we don't have a number yet. Our colleagues in transportation are still in the process of modeling, and there's a number of things that go into that. But basically anything that's, if any change is going to be applied to that number, it's going to be to have it higher. So a higher number of trips going to active mobility. That is a fundamental and significant change that affects how we move around the city. And the opening of Line 1 this weekend is no small part of it. Our current official plan actually is built around the initial LRT Stage 1, 13 stations on Line 1 and 5 stations on Line 2. By 2046, we'll have a network of 7 lines and 142 stations between LRT and BRT. So that's a completely different geography of moving around the city. Third is to keep improving on urban and community design and making sure that we're getting all scales right. We have become better at delivering large projects like Lansdowne and Zibi. We now have to continue getting better at large projects, but also make sure that we're not forgetting small scale, neighborhood scale, community design, and urban design. Resiliency is where we broaden, I guess, the lens that we've had up to this point in the official plan, which was very focused on environmental stewardship. We've done, by and large, a good job at environmental policy, environmental protection, environmental stewardship. That's now not enough. We need to broaden that to include resiliency in matters of public health, in matters of climate change, adaptation and mitigation, as well as energy. We need to talk about how we are going to use and draw energy in the 21st century. And finally, number 5 is really to embed economic development in what we do in urban planning policy. Urban planning policy can either be an obstacle or an incubator to homegrown economic activity, again, at every scale, including the neighborhood scale. And there's a document that goes with these 5 big moves, and I'm not going to dwell on each and every point, but there's a number of preliminary policy directions that flow from these 5 big moves, meaning if Council adopts the 5 big moves, and we're going back with a finalized version in December to joint committees again and then to Council, then there's a number of policies that flow from that. So we have the focus on intensification, which will basically underpin our growth management strategy. What will be the new intensification target? If there is a need for urban expansion, by how much? We're going to link growth to the other objectives that we have in the official plan. We are talking about housing in terms of flexibility and in terms of affordability. Again, housing affordability from an equity and inclusion lens, as well as from an economic development lens, is a very important focus that we're putting on the official plan. We're still talking about infill in a context-sensitive way, and about the character of the rural area and managing growth in the rural area in terms of employment and population. If we go to mobility, we've been working very hard with our colleagues in transportation planning at coordinating what we do from a land use side of things, which is perhaps the siloed approach of looking at what we do, and on the transportation side of things. Really, when you think about it, a good urban plan is a good transportation plan and vice versa. You can't dissociate one from the other. And flowing from that, we have a number of directions. They will obviously touch on targets for modal share, but they also talk about building complete streets. The cycling casualties that we've been having this year are intolerable. We cannot continue like that. We need to continue to improve the design of our rights-of-way so that all road users feel safe. We need to talk about transit and how to feed the ridership of the system that we are continuing to construct through Stage 2. And talk about the emerging technologies in mobility, not just Uber and Lyft, but mobility as a service, and all the things that are associated with autonomous vehicles and the place that they might play, or the role that they might play in mobility in the city. Also, improving intercity transportation, not just to and from Gatineau and the surrounding municipalities, but also to major other centers, Toronto and Montreal, and putting emphasis on the airport. In terms of community and urban design, we want to move to a system of planning policy that's context-based. Right now, if you look at our official plan, there's a lot of yellow on the map. You know, it's called general urban area, and it applies to, you know, Chinatown as much as to Stittsville or Fallingbrook or Beacon Hill. But we all know that each context is different. There are different stages in their evolution. We need to be able to talk about them in that light, and to apply the policies and objectives to each context that match. We want to continue to nurture our culture and heritage, built heritage, natural heritage, and we want to develop a park strategy that's also germane to each context of the city. On city building projects, you know, we're a nation's capital, so we have major city building projects from time to time. The War Museum is the most recent one. We've had, you know, the National Gallery, the Museum of Civilization. You know, what's our next one? And what is our policy framework for intaking that type of major, once-in-a-generation, image-defining project for the city? In terms of resiliency, here you have our colleagues from Ottawa Public Health providing input on what has actually been very quickly well received, the idea of a 15-minute neighborhood. The idea that people should be in neighborhoods where within a 15-minute walk or a 15-minute walk and ride or walk and transit, you have access to the necessities of your daily life, to the necessities of your family's life, be it school, care, shopping, groceries, and the things that make your life complete in terms of a community. We want full-service neighborhoods. Those that are, we want to strengthen them. Those that are not, we want them to get there. We're talking about the urban forest and how it plays a role increasingly in dealing with climate change. So not simply from an aesthetic or an environmental perspective, but also as part of our urban infrastructure. And in terms of infrastructure, again, there's long discussions that we're having with our partners in infrastructure services about how prepared are we for worse. We've had tornadoes, we've had floods. How prepared are we for worst? We are doing climate modeling, and my colleague Andrea Flowers is going to be talking about a little bit of that in her work, as well as in energy. We are in still a paradigm of fossil fuel combustibles. The 21st century is about energy that is renewable and non-combustible. So how do we transition to non-combustible energy? And finally, in terms of economic development, we're going to be talking about employment lands so that we are moving more toward, again, you know, jobs should not be removed from where people are. They should be integrated in neighborhoods. Where should jobs be? And there's discussions that we're having on that. We want to pay special attention to the airport. There's an airport master plan that sees them growing to 2046 to leverage the opportunities that we have being located between Toronto and Montreal to take some of their overflow and increase our capacity for flights to international destinations. We want to do more on business incubation at the neighborhood level and also see how growing into our second million and then third million, that size of city can give rise to new sectors of the economy. And we're putting emphasis on the rural economic development strategy that our colleagues in economic development have been working on. So those are the 5 big moves and some of the highlight preliminary policy directions that flow from. I'll turn it over now to Charmaine for a quick snapshot of our public engagement.
Thank you, Alain. Thank you, Chair. So as Alain mentioned, for the public engagement, I'm fortunate to have the leadership role, working very closely with Alain and his team. I first would like to thank Public Health too. What they're allowing us to do, some public health events, they're allowing us to put out a booth and put out some things that folks we would have not necessarily ever been able to reach, and also giving us a little bit of swag, which I've sent people out, and they were out at the universities for orientation week, and they're between the barbecue tickets and the barbecue, and so they were in between them. And so we had the little pedestrian lights, and so thank you for that, because that made people stop and talk to us, and they probably wouldn't have necessarily stopped and talked to us before, so thank you for that. We're out really doing things a little bit different. We have the ambassadors group, as Alain mentioned, and that's made up of the 11 underrepresented groups identified in the City of Ottawa's equity and inclusion lens. It's been very well received, and as I say to everyone, when I walk into a room and I don't recognize anyone, I'm very happy, because these are people I've never met before, they've never been engaged, and oh, are they ever engaged? We meet about every 3 weeks, and what they're doing is they're helping us put this information and chunk it down to something that is actually meaningful for their community. So all their priorities, some are more meaningful than others, and so how can they bring that back to their communities and get the feedback? So it's a very unique initiative that we've done. Also, the planning team has gone under some equity and inclusion lens training, which is very valuable, and we're doing a special module. Just how do you be inclusive when you're dealing with land use planning? Another piece that we're doing is we're reaching, as I mentioned, university students. We'll be having a university day, an afternoon that will be bringing university students who are interested in land use planning and engaging them. All the ward councillors, I've been out to meet with them, and we've been engaging their communities, more going out to the communities of what's important to them. So as Alain was saying, different communities, different wards have different needs, and the ward councillors certainly know their residents better than we do. So going out there, going out to the rural residents, doing what, instead of bringing everyone to City Hall, let's go out to the different communities. The numbers up there are a little outdated. I'd have to say that so far we've reached over 25,000 people. We've reached over 4,000 directly engagement, and we've had 44 in-person activities, and right now we have 5 polls. So the polls are based on the 5 big moves, so I encourage everyone to go and do the polls. We've had really good uptake with it. The polls are very simple, so they're not and no offense to my planning friends, they're not in planning speak. They're actually something that we all can understand. And so you can look and think, oh, well, that's what it means, and this is how it impacts me in my everyday life. And so we've had really good feedback so far, so I encourage everyone here to please go and fill out the polls. Also, we're doing something, we have Engage Ottawa, and so it's a forum, it's a platform where you can go online, and that's where all the information is. Anything that we do, the 5 big moves, the highlight sheets, the foundational paper of Beyond 2036, it's all there for people to be engaged. And also what I'm doing with that is the ambassadors group and some targeted groups, we'd be able to have some conversation. I'm not there yet to open it widely because it's resource intensive, but we're trying that. And so I encourage everyone to go to that page as well. Next slide, please. Thank you. So just some dates. So as Alain was mentioning, we do have a very tight timeline. So this typically takes four or 5 years to do a new official plan, especially a total refresh. We're doing this a bit quicker in 2.5 years, and time is ticking. So our next September 29th, this is a consultation on the 5 big moves. We'll be doing that through September and October, and we will be doing it right up until committee date in December. Then Council will consider the policy directions and the growth management strategy. Summer will come, next 2020, before you know, another year has passed, and that will be the draft OP will be tabled at Council. Then we have another year to, well, nearly not even a year, close to it, until 2021 to consider the final adoption. So it is quite, very intensive consultation timelines, but I think that we have a good plan in place, and I certainly encourage everyone to be involved. Thank you.
Thank you very much. And I want to take this opportunity to give Charmaine's team a bit of a plug. They were out in my ward last week meeting with community association members. I thought it was an excellent meeting. So this is more for the council members around the table, but if you haven't had them out to your area yet, you should. It's a good presentation, good dialogue, and the feedback I received was very positive. So I wanted to share that.
Thank you.
We'll take questions, but before that, I think I'm going to ask Councillor Menard to introduce his motion while we have staff here, in case there are any questions generated by the motion that staff might be able to help us respond to.
Okay, thanks very much, Chair, and thank you for the presentation and for also helping us with the consultation in the urban wards and coming out to my community associations as well. So I'm not going to read the preamble. It's a long motion, but just to say, worked with staff on this as well with Chair Eglee some more today to refine some elements. And hopefully we're at a good place now. So I'll just read the be it resolved clauses. So therefore be it resolved that the Board of Health for the City of Ottawa Health Unit formally endorse the 5 big moves and express its strong support for Ottawa Public Health to continue advancing healthy, built, and natural environments with a view to advocating for ambitious targets and policies and embedding a public health perspective to the development of the new official plan that will promote positive health outcomes in climate change mitigation and adaptation. And be it further resolved that where such policies go beyond planning and zoning matters, that the Board of Health for the City of Ottawa Health Unit encourage Ottawa Public Health employees to build on past successes by seeking to develop similar collaborative relationships with other city departments in order to advance healthy public policies in areas related to the built environment. And be it further resolved that the Board of Health for the City of Ottawa Health Unit requests that its members, collectively and individually, and with support from OPH employees, serve as public health champions by advocating for healthy public policies related to climate change and the built environment in accordance with this motion at every opportunity, including at other boards, at working groups, at standing committees, at subcommittees, and at council. And be it further resolved that the Ottawa Board of Health support the inclusion of the following in the official plan: a position on the urban boundary expansion that is informed by a public health perspective, that by 2046, a significant majority of trips in the City of Ottawa be made by sustainable transportation, walking, cycling, transit, or carpool, and that the definition of sustainability include affordability. A prioritization of the provision of more quality affordable housing, including the introduction of inclusionary zoning citywide with higher requirements in transit-oriented development areas, the expansion and enhancement of our public spaces, and an emphasis on a built environment that combats social isolation, stress, and anxiety.
Thank you. Some of those changes were made this afternoon. To sort of kick off, Ellen, I don't know if your team has had a chance to have a look at this. Just any comments you might have for us on that? Is this generally acceptable to the process that you're undertaking, or are there some suggestions you would like to make or concerns that you might have?
No concerns, Mr. Chairman. This would be the first time that the Ottawa Board of Health issues a motion taking a position on official plan preliminary policy directions. I think staff will take them into consideration as we continue to build the final recommendations for December. As I indicated earlier, there are areas in which colleagues in other service areas are continuing to work on what will be, the final package. There are two steps really that I would urge you to keep in mind. One is December, where we will submit a growth management strategy that will include an intensification target, and if there is a boundary expansion, by how much. And then in June, as Charmaine indicated, we will have our first draft of the actual new official plan with language, policy language, that board members will be able to check against the content of this motion. So by having Birgit and Inge with us in our staff, embedded with the official plan team, I think we'll be able to have a pretty direct level of communication and back and forth on the content of these items, and we'll be able to have them apply their lens to the work that our planners do in planning policy.
Thank you very much for that feedback. So I have one member on the list so far, Member Cavanaugh, and I'll add Member Lakin to that, and Member Kuche. Member Cavanaugh?
Thank you very much. No, I appreciate the collaboration between public health and the official plan. In fact, I just think it's essential. I did get a chance to go to Portland back in June, a Healthy Living, Healthy Cities conference. Unfortunately, I missed the last public health meeting because it was the same week. But that was the theme. I was amazed at how many public health officials worked with planners in American cities. Like, we think we're ahead of the game, but they were actually doing it quite a bit. So it struck me that this is the way to go going ahead. This shouldn't be new. This has been going on for a little while. I just have to point out, when I'm looking at all these slides, I wonder if it's really Ottawa, because there's no winter. We still have to deal with transportation in the winter. And it's not sunny days every day. I'm an avid cyclist myself, but I really hope that we're looking at that as well, because probably one of the biggest challenges we had in terms of getting people on transit, et cetera, was the weather and how that fits in as well, because that has to be, I guess it fits under resiliency, because we're a resilient bunch here. To live in the city. But I do hope that's taken into consideration quite strongly, because we had quite a lot of challenges. This is related to climate change, and it's not going to change that much. Thank you.
Thank you very much, Member Lakin.
Thanks, Mr. Chair. Great presentation, thanks. And I do have a couple of questions for staff, but before I do that, I actually have a question about the motion and the language of the motion. And I'll leave it to legal counsel to help me with the wording of my question, but it is with respect to the resolution and the last comment that emphasizes a built environment that combats social isolation, stress, and anxiety. And I'm wondering if there was consideration in the spirit of health promotion to emphasize a built environment that promotes social connection and mental health rather than combats. And this may be wordsmithing, but it does convey a different sentiment, and I'm just wondering if there's an appetite to consider this.
Well, I don't disagree. That's a more positive way to state it. So it's not my motion, so I would ask Member Menard whether he is prepared to accept a friendly amendment to that regard?
Yeah, that's fine.
Okay, great.
Okay,
Thank you very much.
so we'll need to get something in writing to, before we vote on it. Is that the only question, Member Lakin, or?
No, that was the least important.
The least,
rest of
okay, well,
staff.
carry on then.
Thank you, but thank you for considering that. It's a great presentation, and absolutely delighted that we're having this conversation. Comment/question related to the resilience metric of the planning process, and in particular, what does the data suggest are the biggest risks, resilience risks, that need to be considered in the planning process from a public health perspective? So if I look at other cities around the world and think about other cities and how they build their environments and plan their process to make happy, healthy cities, what are Ottawa's greatest risks vis-a-vis the planning process that bears on the resilience metric, and what strategies are we thinking about to mitigate that as we plan forward?
Mr. Chairman, I'll start with some remarks, and then maybe I'll ask my colleagues if they want to add. But in general terms, I would say that it's at two levels. One is in the way that we build the city, and the way that we've been building the city since the mid-20th century has responded to principles that came from the mid-20th century that promoted the extensive use of space, the separation of functions in the city, I guess the minimization of the impact of distance, and therefore we have a geographically very large city with areas that have very low population numbers. And as a result, with the passage of time, we can see, neighborhoods where the population between their initial development and now has dropped by 2/3. And therefore schools have closed and stores have closed and services have gone away and bus frequencies have diminished, and those neighborhoods are now, they're not at the edge of the city anymore, they're now a lot more central than they used to be. So the way that we build the city based on that sort of 20th century approach of separating things and sending them out into the distance is one that if we retool that as, again, planning objectives to complete communities, 15-minute neighborhoods, a city based on proximity rather than on distance. Right away you have more opportunities for social cohesion, public interaction, active transportation, free and democratic access on foot to the things of the city rather than to have to consider the socioeconomic barriers that come with being able to access a transportation mode or another, and the remoteness of the things that you need to access in terms of the equity of access. So that's one. And the other lens obviously has all the information that we're starting to now understand with respect to climate change and what that does not only to the city's infrastructure, but to public health. So obviously there's, disaster-related hazards that come from extreme weather events, but there's the public health-related outcomes of greenhouse gas emissions and the public health outcomes that we're now starting to see in terms of automobile dependency on obesity, diabetes, and other sorts of, anxiety or depression-related conditions that we are hearing from our colleagues in public health have become much more prominent in the population. So those, I would say, are the two major vectors.
Thank you. Any other questions? You're good?
I don't want to monopolize the conversation, so I will.
If I could ask, I'm understanding that if you could bring the mic a little closer, because not everything you're saying is getting picked up for the webcast. So, but you're good. You're satisfied. Okay. So next on the list is Member Cloutier.
Thank you very much, Chair. Just to situate myself, where these are questions to staff on their presentation or on the comments with regard to Councillor Menard's motion?
Yeah, either.
Okay.
Either or both.
Thank you. Merci beaucoup, Alain, Monsieur Migalez, pour la présentation, and I too am happy to see Ottawa Public Health involved in the official plan, which is such an important document in the life of our city, and your experience, your education as a planner, you've situated well the the evolution of public health with respect to planning and how disease and from in the past have became planning documents, and we've gone full circle. So thank you very much for the history. As you said, with respect to Councillor Menard's motion, which is a good motion, and I'm sorry I didn't see it before today. One of one of the points in the second further resolve, the first bullet point, exhausting opportunities for intensification within the urban boundary. Intensification, and we'll move to 3 million people by the turn of the next century, comes through densification and intensification or expanding the urban boundary, and I do not support expanding the urban boundary. But I just fear...
Member Kuchar, are you looking at the revised version?
Maybe not.
It says revised on it, I think.
I'm not looking at the revised version.
So maybe you don't have a question. I don't know.
Is exhausting opportunity still there?
No.
It's not?
No.
Oh, well, there you go.
Carrying on.
Where's the... I don't have, that says exhausting. There's another version.
Did you find it? Oh,
I have it. Position on the urban boundary expansion is informed by public health perspective. That's good. Thank you. I'll have more questions once I read the motion.
Okay, maybe I'll while you do that, I'll move to, I believe, Member Van. No.
Thank you.
No. Member El Shanchiri.
I find it, Mr. Chair, maybe the intent of the mover of this motion, but I find it is troubling. We walk into the meeting, you see the motion, and then we see the revised, and I don't understand the logic not sharing this motion ahead of time with the member of the committees. Because when you put a motion like this on the fly, I mean, all what I can do, okay, like how, it didn't give me enough time to talk to staff, didn't give me time to talk to legal, didn't give me enough time to see what does it mean, some of it, in the long run. So I will not be voting for this motion on that principle. And next time, if the mover care about his motion, should share it with his colleague, so we'll have the opportunity to speak with staff and be able to understand the intent of this motion. So thank you.
Thank you. I didn't see that as a question. So, Member Kuche, have you now had a chance to?
I do. It's not to staff, it's with respect to the motion. That's in order. Very well. And forgive me if I don't know, were there any other changes in the revised other than that first bullet point, just to anyone's?
Yes. So in the be it resolved paragraph above that, the terminology in accordance with this motion, so that public health champions, et cetera, in accordance with this motion. And the rationale, if I can share that, Member Menard, from our discussions, is the board speaks with one voice. So what it basically is saying, or the intent of it, is that this motion puts forward several positions that the board may or may not endorse tonight. Assuming that they do endorse it, then if members of the board are talking about the role of public health in the development of the official plan, this is in effect your blueprint for those discussions. So you don't sort of go outside of those parameters. This is what the board, as I say, may or may not approve. And if it does, then that's our speaking notes, if you will, going forward.
Good. Thank you for that. Thank you for that change. That was another one of my points, that we speak with one voice. Councillor Menard, I guess the only other item that I have a concern with is with the second bullet point, I don't know what significant majority means. I think the presentation spoke of a majority of trips be made by 2036 by sustainable transportation, and how we are sustainability, and that the definition of sustainability include affordability. And let me just talk a little bit about that. I think, if I might, you are referring to the cost of transit. You're certainly not referring to the cost of bicycles or running shoes.
No, I am referring to the cost of all forms of transportation. Walking, cycling, taking transit, carpooling are all less expensive than, say, a personal vehicle use with one person in it. And so I want to make sure, because I've asked for this through the TMP as well, a cost per trip calculator for Ottawa, as Calgary has done. And that sort of references it, that there's an affordability quotient to when you're, where you're traveling from and how you're getting there will affect both your own finances and the city's finances. That's what I was trying to get at.
So
I can interject for a second.
Yes.
I don't know if, Alain, you can answer this question, but as part of the official plan, I'm assuming that there will be a refresh or a redo of the origin destination study. Is that going to take into account in any way it will certainly take into account how people do it, but will it in any way take into account the costing of the trips?
Well, pursuant to Councillor Menard's request to staff, yes, Mr. Chairman. So the Origin Destination Survey has a number of standard questions that have been done for years and years, and we keep the same questions for comparability, but the affordability piece that is now introduced is something that we're pursuing with our colleagues in transportation.
So I guess the question then becomes is, with that in mind already being accepted by you in another forum, is it necessary in this motion as well, or is it redundant? And I don't know, you're already doing it, I guess, begs the question whether we need to ask the question again, Member Menard, that's all.
So it's slightly different, Chair, because they'll produce the figures around affordability, and they'll be there for us to look at. But what this is saying is that we're encouraging sustainable transportation when it comes out. So we'll see those numbers to inform that, which is what the TMP and the official plan will update for us. But this is actually calling for us to encourage a significant majority of trips be made by sustainable transportation. I think staff's probably pushing that way anyway, and it's left a little bit ambiguous. Significant majority, what is that? 60%, 65, 70? It's left that way because we're trying to get to more than 50. That's the goal. A significant majority, more than 50, and I think staff's actually heading that way in the general direction. I think it's important we keep this in here and reference the affordability piece once again, which we have modes of transportation which are much more affordable for folks, and if we can encourage those, it saves us money as well. And I think from a public health perspective, which is what this is all about, at the end of the day, that is healthier for folks too to take these types of transportation.
I guess a follow-up question from my perspective, Alain, is I asked you this sort of at the beginning, but now we're getting into a discussion of it. As worded, is this in line what staff intends to do? Is it a concern for staff? Is it going to involve additional resources? I think those are the sorts of things that Councillor Cloutier is, I don't want to put words in your mouth, but concerned about.
I fear that the way I'm reading the motion, that sustainability include affordability, the study of sustainability and the information on sustainability can and should include affordability, but should not prescribe affordability. And of course, the city has a long-range financial plan and significant investment in phase 2 and the service and the frequency, which will lead to a more sustainable city and a healthier population, all of which I support. But we should not be, I think this is trying to put some, and I don't know the definition of affordability in numbers terms, but it is setting a budgetary target. But I might be reading it incorrectly.
Mr. Chairman, we would do this anyways. As staff, we would present a number of options that are simply based on mathematical calculations. If we opt for a certain type of growth management strategy, then the outcomes in terms of infrastructure required to sustain are such. Same as if we have a target of X for active transportation, well, the outcome is an investment of such in each of the modes, and if we have a target of Y, then it translates into a different package. So this is simply information that over the fullness of time, and as the TMP is prepared, you would have access to anyway. So to your earlier question, Mr. Chairman, we do this in-house. There's no extra resources or it's not an extra work plan item for transportation staff to do this, and we'll be working with transportation staff to arrive at the answers as they develop their modeling.
So if I may ask a question, might help clarify or so Alain, what you're saying is staff is already of the mind that included in the definition of sustainability is affordability, that's part of the definition, is that already?
By and large, Mr. Chairman, yes. I mean, when we recommend a package to committees and council on a growth management strategy, we will have vetted with our colleagues in transportation and in infrastructure what it means to the taxpayer of the City of Ottawa. And so to the extent that, and our predecessors at the regional municipality and those who came before us here at the amalgamated city have done the same thing. You would ask this of us one way or the other. We have an official plan. We are anticipating growth management strategy of such. What does this mean for the taxpayer? So that it's part of the package.
Does that help, Member Cloutier?
Thank you.
Any other questions? Are there any other questions from any other members on either the motion or the presentation? Okay. I'll call the vote then. I think there may be only, do we need yeas and nays, or is there?
Were there changes
yes,
made
sorry,
to,
fair enough, yes. If we could read the, have we agreed upon an edit?
Yes, we did, Chair. So it's the last bullet point is that an emphasis on built environment that promotes social cohesion and connectedness and mental health.
Okay. Again, Councillor Santeri's indicated that he's going to dissent. Are we okay to carry with that exception? Okay, thank you. Yeah, it'll be duly noted, Councillor. And do we receive the report then for information? Okay, thank you very much. That was an excellent presentation.
I just want to extend my thanks as well to you, Ellen, and to Stephen for the support for this collaboration.
Thank you, Mr. Chairman. Thank you, Dr. Etches. Thanks, colleagues.
The next item that we held was item number 5, which is Ottawa Public Health's 2019-2020 influenza season updates. And we have a presentation with Marie-Claude Turcotte. And I think, Dr. Etches, you wanted to speak briefly to this before the presentation?
Sure. I just thought, since there's been a little bit of media coverage about vaccine availability, that I just wanted to be clear that the vaccine supply, the ordering, the provision of different kinds of products to different sectors, public health, pharmacies, it's complex, and so we do not have exact dates for vaccine distribution. This is something we're talking to the Ministry of Health about. I can't quite say continuously, but we're regularly in communication with the Ministry of Health, and so we're going to continue to provide information on vaccine availability to providers, to the public, as it becomes available. And so again, more specific information about our clinic dates will be provided when that's known.
Thank you very much. So I'm looking at the time, and we have a presentation, and I suspect we may have some questions following the presentation. So I'm going to ask Member Gower to introduce the motion to extend time after 7 o'clock.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 o'clock p.m. pursuant to subsection 8.1c of the procedural bylaw.
Thank you, and I'd ask if we can carry that, because Councillor Cloutier will turn into a pumpkin if we don't, and it goes past 7 o'clock, so. Carried, thank you.
Thank you. Good evening. I'm Marie-Claude Turcotte, and with me tonight are Dr. Carolyn Pym, public health physician, and Dominic Bremner, who's the program manager of our infection prevention and control. I'm here tonight to present our plans for the 2019-2020 influenza season for your information. OPH has several functions during the influenza season. We ensure that the vaccine is available in the community through the different providers and our OPH-led clinics. We inform residents on the importance of vaccination and ways to prevent the spread of influenza in our community. We monitor and respond to outbreaks. We also monitor the number of cases and any trends in the community relating to influenza so we can respond accordingly. And we work with our partners to plan and implement prevention and response activities. For the 2019-2020 influenza season, as Dr. Etches mentioned, we've been in discussion with our colleagues at the Ministry of Health, and we continue to discuss with our colleagues in terms of vaccine availability. We have learned that the nasal spray vaccine, FluMist, will not be available this year in Canada. This vaccine has been available in the past few years for children between the age of 2 and 17. Last year at our OPH clinics, about 41% of children chose that option over the injectable vaccine. So still the majority of children chose the injectable vaccines. This year, OPH will continue to offer clinics who will be prioritizing the ones that are most at risk, as well as people who are facing barriers in accessing the vaccine. We'll have clinics in rural areas, in areas of high concentration with young families and isolated seniors, in shelters, in group homes, and we'll also hold clinics for children under 5 and their family, as children under 5 cannot be vaccinated in the pharmacies. Speaking of pharmacies, they will participate again this year in the influenza vaccination program. Through a number of social media and earned media, OPH will, in collaboration with our partners, OPH will continue to promote the vaccine, both for high-risk and general population, and will also raise awareness around the importance of preventing the spread of influenza in our community. That will do that through local and provincial campaigns. During the flu season, we continuously monitor influenza activity in the community. We report on the number of cases and outbreaks. This enables us to monitor any trends in the influenza activity, communicate with our partner, and work together to mitigate the risk for residents. This report is updated weekly and is posted on ottawapublichealth.ca. We also respond to all the outbreaks, including influenza, that are reported to us. These outbreaks may occur in schools, in hospitals, in long-term care residents, in child care centers. This year, in order to strive for quality improvement, we've developed an approach where we focus on the facilities that are the most in need for public health resources. The ultimate goal is to improve the health outcomes of residents. Finally, as I mentioned earlier, we work collaboratively with our partners in the health system. OPH has a facilitating role. We bring together the different partners in order to plan the pandemic plans and also respond to influenza activity, and that's done in a goal to minimize the pressure on the healthcare system. We also work with our public health units and provincial colleagues in order to share best practices and align our responses. So that's what we have planned for the influenza season this year. We're happy to take any questions.
Thank you very much. Vice Chair?
I did have a question about the information in the report, and it's not specific to the motion that we have in the correction. I noticed the influenza vaccine rates for 18 to 65 and for seniors. Do you collect information around 0 or 6 months to 18 years of age?
Unfortunately, no, this information is not collected. The information we get is from a provincial survey. It does not include children.
Are there plans to advocate for that? And is this something through Can Immunize that perhaps we could promote the use and we could get some data that way?
Yes, that's a very good suggestion. We are actually in discussion with Can Immunize to be able to send proactive messages to people who have downloaded the app on their phone. So influenza vaccine, absolutely, for children would be a way to promote that.
Perfect, thank you.
Thank you. Member Gower.
Thank you, Mr. Chair. My question is around page 4. It notes that vaccination coverage among adults 18 to 64 with at least one chronic medical condition was low at 50% compared to the national goal of 80%. And I'm curious how Ottawa compares to other municipalities in terms of the rate versus the national target.
Through you, Mr. Chair, I don't have the number handy here, but I could send you that information.
In general, I mean, do we have a sense that we're doing well, we're around average where municipalities are?
In general, with our immunization coverage rates, we are above average compared to the other health units.
And has that been a steady, or have we seen that trending up over recent years? Or
sorry, I missed
in terms of our number of 50%, has that number changed? Is there any trend that we've seen over recent years? Are more people getting the vaccination, or is it staying the same? Or?
No, it's staying the same. It's steady.
And what would be the barriers that we're seeing to getting that number higher for that population?
I'm not sure what the barriers are, but definitely we continue to promote the vaccine, promote the importance of getting vaccinated, especially people who are at high risk of having influenza complications through different social media. We also promote in our earned media, so continuing to promote it with the general population and high-risk clients.
This is an area where we can drive more prevention in the healthcare system. You could see if we're working with Ontario health teams and we're targeting people who have chronic diseases, that's the kind of role we could play to provide that feedback to individual OHTs about their population and how they're doing. So that is certainly something we have our eye on. How do we work with the healthcare system to particularly target populations at higher risk?
Okay, thank you.
Member Gower, just following up quickly on Member Gower's questions about how we might be able to increase, and I don't mean to put any members on the spot, but should members decide to get their flu shots in a public way, whether that be at the public health headquarters, at the local pharmacy, is public health got the resources to make sure that that message gets out via social media channels, photographs, videos, what have you, to push the message?
Absolutely. We have a lot of followers on Twitter and our different social media, so yes, absolutely.
So again, not to put anybody on the spot, but I'd urge us all to if we're going to talk the talk, we should walk the walk as well, and roll up our sleeves and get the shot when the vaccine comes out and let everybody know it's. What's that? We could do that. We could do that perhaps. We can work on that. But I just think if we want to get that message out, we have to be prepared to do it ourselves and let people know that we're behind the program. So maybe we can talk about that offline and organize something to make a statement. Councillor Cavanaugh.
Any occupation that requires shaking hands should definitely do it.
That's a very good point. Member Cloutier.
Merci, Monsieur le Président. Merci beaucoup pour votre présentation, Madame Turcotte. The delay in the vaccine has nothing to do with determining the strain of flu that it will be fighting. It's the active ingredient, I believe, that is causing the delay in receiving vaccines.
Member Cloutier, it's very complex in terms of, the ministry is looking at the supply that comes to them, and then they turn that around and provide it to the field. And they would indicate that there are many factors involved, so we don't have a specific reason that could affect vaccine availability this fall. We know there are multiple factors, and so we are waiting on detailed information about when exactly vaccine will be available and what quantities. I can't point to one specific factor that might affect supply.
Okay, thank you. With respect to, if you could just refresh my memory, and I don't know if it'll be Mr. Flaboria who could help me, who pays for the vaccines?
The vaccine is free for all Ontario residents. It's provided to health units from the Ministry of Health of Ontario.
So the Ministry of Health pays for the supply of vaccines?
That's correct.
The clinics are from our budgets, or is that also a fund, a transfer, a subsidy, call it what you will, from the Ministry of Health?
We do receive an amount per vaccine that we give in the community. It doesn't necessarily cover all the cost of the clinic, but we do receive an amount, a fixed amount per dose of vaccine that we give.
Okay, thank you.
Are there any other questions? Member Banham.
Very quickly. Are you looking for other community partners to host clinics, or is that something you are looking for in the future?
We're certainly open if other community partners want to host clinics. We're definitely open to discussing that possibility with them and making that happen.
Any other questions from members? Okay, can we, oh, yes.
Sorry. With the availability of vaccines through pharmacies, have we seen a decrease, or how has that impacted the public health clinics?
Last year, we actually saw an increase of the number of vaccines through our clinics. There are still residents who prefer to come to public health-led clinics. It varies from year to year, but definitely between the previous year and last year, we did see an increase in uptake in our own clinics.
Any other questions before Member Gower introduces his motion? Okay, Member Gower.
Thank you, Mr. Chair. This is a technical motion to correct a discrepancy in the report. Whereas errors were detected at the bottom of page 3 of the above reference report with respect to the percentage increases in the flu vaccine directly administered by OPH and the number of doses distributed to community healthcare providers. Therefore, be it resolved that the background section be amended by replacing the reference to the increase in doses directly administered from 30% to 36%, and to the number of doses distributed to the community health care providers from 30% to 8%.
Carried? Carried. Thank you. Received the report? Received. That brings us to the end of all the held items. We now have a motion to adopt reports from Member Gower.
Thank you, Mr. Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled New Official Plan, High-Level Policy Directions Presentation, Ottawa Public Health Work on Climate Change, Ottawa Public Health's 2019-2020 Influenza Season Updates, Ottawa Public Health Submission to Health Canada on Proposed Vaping Products and Packaging Regulations, Ottawa Public Health Submission to the Canadian Food Inspection Agency on Proposed Food Labeling Modernization Regulatory Amendments, 2018 Annual Report and Attestation to the Ministry, 2019 Operating Budget Q2 Board of Health for the City of Ottawa Health Unit Status Report, and Delegation of Authority contracts awarded for the period of January 1 to June 30, 2019 be received and adopted.
Carried? Carried, thank you. Are there any motions requiring suspension of the rules of procedure? Okay, seeing none. Any notices of motion for consideration at a subsequent meeting? Okay, thank you. Member Gower, confirmation bylaw, please.
Be it resolved that confirmation bylaw number 2019-5, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting on September 16th, 2019, be read and passed.
Carried. Thank you. Are there any inquiries? Seeing none. Adjournment? Carried. Our next meeting will be November the 4th at 5 p.m. And again, if I could ask all the members to stay for a few minutes so that we can get a group shot. Thank you.